Hello, I'm Said Safkani. My research focuses on medical application of virtual reality. Specifically, we reviewed the articles concerning the application of VR for treatment of anxiety and psychiatric disorders. In recent years, the application of VR in various scenarios had seen a large increase with the introduction of consumer-based head-mounted displays. It means easier access to the technology with improved interaction and usability. Medical application of VR is always one of the leading research topics. It has a long history and increased rapidly with the time. We can classify the medical application of virtual reality into three main categories: an educational and experimental environment for training experts and students, a platform to enhance sustainable healthcare, a technology for diagnostic and treatment of physical or mental diseases. As an example of this application, we can mention a research by Harrington concerning simulation of rare or complex cases of decision-making in a safe environment, or as a tool for rehabilitation to improve the motor function in individuals by Keeper 2016, or assessment of physical functions for stroke patients and improve self-reliance in daily life activity by Lever, or lowering the blood pressure for elderly similar to traditional walking exercises by Da Silva 2018. The reason that we can apply virtual reality for mental and psychiatric disorders is that the brain continuously tries to calculate a model of the body as a definition of me internally and place it in the external world. Using this calculation, it frequently updates the prediction of expected sensory input and tries to reduce the number of prediction errors. This hypothesis leads to an idea: if the brain uses the embodied simulation predictions, we can fool the brain by giving it a synthetically created environment to achieve desired results. This can be useful in a case where it's not possible to access or imagine a certain condition or environment. In many cases, it has been difficult for patients to imagine a specific location or situation. This leads to a reduction of the effectiveness of traditional therapies. Virtual reality exposure therapy, or VRET, is a method of psychotherapy that uses virtual reality technology as exposure. VRET gives therapists the possibility to create various arbitrary environments that are believable to patients. Several parameters in these environments are measurable and can be analyzed later. In this review, we will consider 5 research questions as following. What VR technologies are common in recent years? What are the reported evaluation methods? What are typical participant numbers in the reported studies? How high is the dropout rate during the studies? What is the typical number of sessions held? First, we will categorize the VRET according to the disorders. The theory of emotion processing suggests that exposure can alter the relationship between the fear stimulus and these networks. In this case, an immersive environment offers patients the opportunity to create a sense of presence to stimulate and modify the source and response to the specific disorder. Post-traumatic stress disorder is a mental health condition that is exposed by traumatic or terrifying events. The studies suggest VRET for the treatment of PTSD as a promising approach with no significant additional self-reported simulator-related side effects. Panic disorder is often characterized by repeated panic attacks. Agoraphobia can be defined as a fear of being in a situation from which one cannot escape. The situation for triggering panic attacks in patients can be exposed by predefined environments in VR that evokes the symptoms. VRET shows an improvement in the course of the patient's anxiety and measured depression. The idea of pain treatment or reduction is to distract the patient's attention from a specific source of pain. VRET can play an important role as a distraction tool during a painful procedures. Studies shows the positive effect of VR-based intervention on patients undergoing medical procedure compared to traditional methods. Generalized anxiety disorder, or GDA, characterized by general anxiety in which the patient experiences a persistent, chronic, and sudden worrying that occurs independently of any external events. VRET can use in GDA case with 2 aspects. If properly addressed, VR can be used as a treatment. It can help as a relaxation and mindfulness exercises if it cannot properly addressed. Specific phobia is a type of anxiety disorder characterized by irrational or exaggerated fear of certain objects or situations like animal hides, needles, or bloods. Reported showed VRT could have long-term positive influence even comparable to vivo exposure therapy. Schizophrenia is a type of psychiatric disorder characterized by psychotic symptoms, abnormal behavior, and severe issues in cognitive functions. Studies showed a positive tendency either to improve social skills or to encourage patients to continue the treatment procedure using VR. According to our finding from literature, we can say the VR technologies used in recent years are mainly consumer-based head-mounted displays such as Oculus Rift and HTC Vive, as well as mobile-based devices. Despite specific measures for each type of psychiatric disorders, they use different questionnaire as a method of evaluation. The typical number of participants varied according to the research limits and was mainly between 15 and 100 participants. In the reported study, the dropout rates varied between 0 to 60%. The number of sessions required depends strongly on the type of VR therapy. We find out VRET could lead to a reduction in the dropout rate. The acceptance of VR by patients is higher than achieved one with traditional methods. Taking the personality of the individuals into account when designing the playful environment will increase the patient's engagement in continuing further treatment sessions. The modular design gives the therapist the possibility to create a flexible environment according to the needs of the patients. Many treatment methods could be more effective if they were repeated accordingly. However, it appears that prolonged treatment leads to higher dropout rates. Patients should be able to participate in a therapy sessions remotely from their own preferred location as a telemedicine to avoid this problem. The idea of telemedicine introduced the need for a generalized tutorial design in VR. Patients should be able to learn VR interactions and familiarize themselves with the environment without having physical contact with the therapist. As the conclusion of this review paper, we can say virtual environments have some heritable properties that leads to faster or longer persistence of therapeutic effects in patients. Where patients have doubts or discomfort concerning therapy or are difficult to motivate to continue their treatment, VR can be beneficial to increase their interest and motivation. When the imagination on the part of the patients is required in some specific situations or condition for stimulating and simulating the symptoms of the psychiatric disorder, VR can play an important role. Thank you for watching my video presentation. If you have any feedback or would like to discuss any aspect of my work further, please contact me via email.